The cost of cancer do not impact all patients equally. Evidence consistently shows that certain factors such as race, ethnicity, health insurance status, income, and where a person lives impact cancer diagnosis, treatment, survival, and financial hardship experienced by people with cancer and their families. We talk about the cost of cancer treatment in Kenya and what could be done to ease the burden on patients. Our guest this morning include Dr. Geoffrey Mutuma, cancer researcher at the KEMRI, as well as Teresia Njeri, an adenoid cystic carcinoma cancer survivor. Later on, Lucy Njeri, who is a breast cancer survivor, will also join us. This is KTN News Center, and my name is Purity Museo Nzuki. Let's begin with our top stories. Deputy President Rigathi Gachagua set to address the high-level United Nations Summit +2 stock-taking on financing food systems, while pressure mounts on the leaders of Kenya Kwanza and Azimio la Umoja to come to the table ahead of planned maandamano this Wednesday. Also, protest by opposition Azimio One Kenya set for Wednesday amid claims of police brutality and harassment as several groups and individuals increase calls for dialogue. Long-distance truck drivers showed dissatisfaction with the system that has always been the cause of snarl-up as a truck pile builds along the busy Eldoret highway with heavy traffic from Kimaiti Junction, 15 kilometers from Malaba, one-stop border. Right, and the cost of cancer don't just end when active treatment ends. On the show this morning, we explore the cost survivors face as well as the lasting financial impacts of high cost during active treatment. Once again, live in studio, we do have Dr. Geoffrey Mutuma, who is a cancer researcher at KEMRI, and Teresia Njeri, who is an adenoid cystic carcinoma cancer survivor. Thank you so much, Njeri and Dr. for making time for us. Let's begin. We do understand on the burden, especially as far as cancer research is concerned. So let's talk about the burden of cancer in the country and probably from research, which are the leading cancers in the country as we speak.
Thank you very much. My name is Dr. Geoffrey Mutuma. I come from the KEMRI, Kenya Medical Research Institute, where I've been doing cancer research for a bit of time. And I also run the Zabes Cancer Hospital, which is in South Bay. Now, cancer has been a major problem in this country, and I think I started my cancer research in 1998 in Cambridge. And since that time, we have had a lot of research on cancer, and we have known a lot about cancer. I think when I started my cancer research in Cambridge, cancer was not common in 1998 to 2000 was not very common. But nowadays, cancer is very common. Cancer is affecting every family, every community. And as a country, we have got a real problem of cancer. And what's a fact about cancer is that cancer will continue becoming common. Cancer will not reduce. So what we should do first as
and why is this so? That's not so much good news.
Yes, cancer not good news, but that's a fact because cancer is a lifestyle disease. Cancer become common because as a country we have developed. Cancer used to be a disease of the developed countries. And now since cancer has developed and also Africa in general has developed, and we have changed our lifestyle mainly because of diet. Cancer is common because of diet, and that's why I find that because we have changed our diet. I'm sure most of viewers today, they have taken tea and coffee and sugar and bread. That's where it starts. So once we are taking this diet, has changed all over the country. And in the last 30 years, I've done cancer research for now 25 years. And I've been following keenly about cancer for the last 25 years. And I've seen there's a change of diet, the change of lifestyle, and many other factors which affected us as a community. So the factors which have affected us as a community means that cancer will be very common, and that's why I've said that will be very common cancer in this country. And what is very important and what we have to focus both as individual, as a community, and also as a country is that cancer affects Kenyans very early in age. We find that most of the literature we have to this time is from Europe and from America. We find that the rates of cancer has come down in Kenya, 20 years down, We find that cancers which are common in Europe at 60, they are common in Kenya at 40. Cancers which are common in Europe at 50, they are common in cancers is normally at 30 years. That's often that the cancers in Kenya, they are going to be very common, and we need actually as a country to focus mainly what we need to do about cancer, because it's a disease which will be with us. And the only thing with cancer is not painful. And I think that's a statement which I make most of the times, and people wonder why. It's because cancer is normally in stages. Cancer stage 1, stage 2, stage 3. It's not painful. You are not aware about it. We know about it when stage 4. And that's when we find that almost between 80 and 90% of the patients who come to the hospital, 80 and 90% patients who have got cancer today, they are in stage 4. Stage 4, it means that cancer has grown. We have been with you for almost 4, 5 years, 10 years in the body without knowing. So by the time it has signs and symptoms, it's already too late. And that's why I find that most of our patients today, they come to our hospital when they are too late. So the issue is, what do we need to do with cancer? What do we need to understand? Before we come to that, is that which cancers are common? Because cancers are so many. And I think like Teresia here was having adenoid cancer, which is very rare. In fact, it does not even appear in our common 20 cancers. It's quite rare cancer. And of course, it's not even, people don't know about it. But cancers which are common in this country, we normally divide them in 3. There are cancers for women, cancers for men, cancer for children. They are different. Cancers for women, which are very common, cancer of the breast, followed by cancer of the cervix, followed by cancer of the esophagus, cancer of the stomach, cancer of the colon, cancer of the ovary, cancer of the endometrium. Those are cancers in women, which are very common. In Kenya, we find that almost every village, every institution, they have a lady with cancer of the breast. That's how common it is. Everybody knows that there's somebody who had cancer of the breast. It means that cancer of the breast is very common in this country, and you continue to be common, and you will be affecting our ladies, our sisters, and our mothers very early. We are talking about 20 years, 30 years, 40 years. The peak age in Kenya for cancer of the breast is around between 35 years, 45 years. That is quite common and very low in terms of age. Cancer of the prostate, which is common in men, is cancer number 1 in men. Cancer of the prostate, followed by cancer of esophagus, cancer of the stomach, cancer of the colon, cancer of the liver, cancer of the pancreas. That's how they rate in men. We find that cancers differ both in men and children. In children, it's very different. Because in children, the common cancer is cancer of the blood, cancer of leukemia, cancer of lymph node, lymphoma, cancer of the kidney, and cancer of the muscles, cancer of the bone. Those are cancers common in children. So you find that cancers are quite common. In children, the rates of cancers remains the same. That not change, because cancer in children is not affected by lifestyle. Cancer in children is not affected by diet. Cancer in children is not affected by pollution. It's mainly affected by genetic makeup of that child. But cancers in adults, we find that in all cancers, the risk factors are the same, all cancers. But you find that in men and in women is normally different, because breast common in women, prostate common in men, and that's often those cancers are quite common, and they are rising up in Kenya.
All right, and we will look at the treatment options, because once someone is diagnosed with any type of cancer, then the family gets worried, and not just because of the treatment or the cost of the treatment, but there's no much faith that they can successfully go through the treatment and get cured completely. We shall get to that. Once again, Teresia, karibu sana to the show.
Thank you.
And feel at, not home, but at the studio.
Thank you.
Yes, so take us through your journey, because you are diagnosed with one of the rare cancers that we know and even have right here in the country. So what were you feeling, and at what point did you decide to go to the hospital?
My name's Teresia Njeri, a cancer survivor twice, and I thank God for this far. In 2020, February 26th, I felt like a strain at the back of my head. So I went to the hospital for normal checkups. And that's when the doctor said, because you have that fluid that you think it's a flu, let's go for further checkup. So I went and I did an MRI, though I didn't have any sign or any symptoms. It's only I felt like a strain at the back of my head. Then after that, I did a CT scan, a head CT scan, and they noticed a polyp on the left side of the face.
Yeah.
So I was referred to a general hospital for more investigation. And by that time, I didn't know more about cancer.
Yeah.
I had never met someone with cancer.
Yeah.
Neither did I ever talk about cancer. So it came to me as a shock, and it only happened just in a few weeks.
Yeah.
I went for the biopsy, and the results came that I have a rare type of cancer. So I never went for counseling. I never did like how people go, they get
To the support groups.
To the support groups.
Yeah.
So to me, it came as a shock. And I was all alone in the hospital. So I called my family and I told them I had gone for the results after the biopsy was done. So my guardian came. My grandmother came also, because for them they knew that word cancer.
Yeah.
To me, it never hit me. So from there, we started now the process with the help of my guardian and my family.
Yeah.
And I remember we went to see several doctors, and they could say, Teresia, this is cancer. So from that time, they decided I do another scan for the chest and the stomach, of which I did. It was okay. And the doctor kept saying,
Yeah.
Teresia, this is cancer. And to me, it didn't ring on my on the back of the mind. So after that, my guardian seemed to be very shocked, and she really understood what cancer is. And actually, cancer is very expensive when you don't have like resources, you don't have that money, because every time I could go see a doctor, they could tell me you should hurry up. So, and no corona was there because it was on 2020. So we went and searched for an oncologist who really helped me. And the oncologist gave us only 2 weeks, because I was supposed to be done an intense surgery to remove the jaw, the palate, to make a new gadget. You see, and all this is not even clicking to me. I used to act like it's normal because there's no pain. Even when people could ask me, where are you sick? I will tell them,
I'm not sick.
I'm not even sick, because they already did the biopsy. So I never knew how cancer.
Yeah. And that was a good attitude. Maybe it helped with your quick recovery, yeah?
Yeah, it did.
Yeah.
So my guardian from there became worried, because we were only given 2 weeks. And she was told, we need to buy this metal chip and a mesh, and they needed to make an obturator. So my guardian was worried, because every time she could ask the doctor, are we going to remove the eye? She was worried about the eye.
Yeah.
Teresia is a mother. How will the daughter see her mom? How will these changes be?
Yeah.
So she kept asking the questions. And I think that support system at that moment really helped me, because she seems to care so much. And may God rest her soul in peace. So that time, my guardian was the one who, she never wanted me to know about the finances. So she could go talk to the doctor. So at that time, one of the time, we were given 2 weeks to go sell everything, buy the metal chip, book the surgery. And the metal chip, that made me shocked, because the doctor said like it costs around 400 and something, and there are some screws, and each screw is 30,000. So you see, and I could imagine, where are we going to get the money?
Yeah.
So my guardian really hustled. We looked for the money, the deposits, because I went in a private hospital to be done the surgery. And in a private hospital, there is a deposit of around 80,000 to 100,000.
Yeah.
So that we may be admitted. So I was admitted on 16th April for the first surgery. And that is where I usually say my life changed completely.
And you'll tell us how it did.
Yeah.
Dr. let me get back to you. And just a clarification, cancer is the leading cause of death globally. Is it the same case here in Kenya?
Not really.
Yeah.
I think I said that quite a long time. I said by 2025, cancer will be killing more people than all diseases combined. 2025.
Yes.
That time I thought 2025 was very far. I'm so surprised too near. And already cancer is killing more people. I'm sure everybody in every village in this country, at least there's somebody who has passed on because of cancer. Every village. So it means that cancer is a real problem and is rising very high. Cancer has been quite common in Europe and America. Very common,
yeah.
But in Kenya it came recently, but is rising very high, and more so in Africa countries, all of them. More so Kenya in Africa there is cancers rising now in Kenya because, as you know, that Kenya is one of the most developed countries in Africa now. In cancer it used to be, and it is up to this time, is a disease of the rich.
Yeah. The
more rich you become, the harder you have of getting cancer. The reason is that when we used to be quite poor, and me, I'm not young, so I experienced poverty. You know, a long time we didn't use take tea. Even milk and tea was luxury at those time. And bread, we used to see it once in a while when my dad used to come home from Nairobi. Now, at this time, in every village, every home in this country, they take tea with the sugar. Sugar is cancer feeder number 1, followed by milk, followed by rice, followed by chapati, followed by all other foods which we eat. So that because of this change, for the last 30 years, what we have changed to and where we are now, every Kenyan has got very high chance of getting cancer. In fact, I did some checkup in Kibera, which we expect to be in the lowest site of living. In fact, cancer is very common because you discover in most of the urban areas, most of the informal setting, settlers in Kenya, settlements in Kenya, they eat very badly. In the morning they take tea, there's mandasi, there's chapati, there's a bit of meat. Those are the factors which raise the chances of getting cancer. And that's why you find that as far as we said cancer was for the disease of the rich, now in Kenya cancer is very, very common. And the only thing we need to know about cancer, and we need to know about cancer, treatment is very important.
Yeah.
And research is very important. Of course, that's what I've done in Cambridge since 1998. Although I had a break in Cambridge, I spent a break of 10 years. I went back to Cambridge in 2021. I had a break in from Cambridge, but of course I was doing still work for cancer because I was running my hospital, which is the best hospital in South Sea. Now you find that what we need to know about cancer, not research, not treatment. Treatment is very important, but we need to focus on awareness and screening. What will save lives in this country is not treatment, it's not research. What will save life in this country, there are two things. Creating awareness about cancer. Everybody to know that cancer is very, very common and cancer can affect everybody. Second thing is to go for screening. Screening is when you go to be checked for cancer without having any signs. Remember what Teresia said? She was not aware and she had no pain. She had cancer, no pain. She was not sick. And that's a statement which Teresia has said, is a very important statement. When you have got cancer, that's what I tell my patients. When you are not cancer, you're not sick, you are supposed to continue with their normal life. Because some people, when they are told they have got cancer, they get sick. Some people, they get paralyzed and they stop working. When you've got cancer, continue working your normal work. The only time you cannot work is when you feel sick. When you are given the treatment, you get sick and things like that. And that's why I normally encourage patients, because positive thinking in cancer treatment is very important. So what we need to do is create awareness on cancer, do the screening, encourage people to go for checkup for cancer. Before, I think the turn-up was very low, or the uptake for screening was very low. Nowadays, it's a bit better, but it's still very, very low. And that's why I found that most cancers can be discovered even 10 years before you have it. Can be discovered that you have got risk, or you have got this cancer in the stage 1. especially cancer of the prostate, cancer of the breast, cancer of the cervix, cancer of the stomach, cancer of the esophagus. You can be known very long time before you even have signs and symptoms. And that's why awareness, screening, and then diagnosis. That's where an issue is, because when it comes to the diagnosis, people take a lot of time. You know you have got a swelling in the body. It's not painful. So you are not taking a lot of time.
Yeah.
Because most of us, and we are used that, we tend to go to hospitals when we are sick.
There's pain. Yeah.
When there's pain. And that's why we miss it in cancer. Because patients wait until they have pain so that they can go to the hospital, which actually is not right. For cancer, you need to keep on checking ourselves every year, every 2 years, every 4 years for several cancers. That is what will save our lives. Now, diagnosis. Diagnosis is normally quite expensive, not cheap at all.
Yeah.
And I'm sure Teresia experienced that.
Yeah.
It was not easy because diagnosis, and the way to do the diagnosis is by taking a biopsy.
Yeah.
Cancer diagnosis is taking a biopsy. There are other methods, other tests, but the actual test, the hallmark of diagnosis of cancer is doing a biopsy, removing a small tissue of that swelling, taking to a pathologist to look at it. And me, I'm a pathologist. So I see a lot of cancers almost every day. And normally when I see a patient with cancer in the microscope now, because I normally diagnose cancer myself, is that my question which I ask myself, especially cancer of the cervix, which is quite preventable. And most of the women who have got cancer of the cervix now, they all come stage 4. No, there's no question about it. In fact, in my life as a doctor, there are few patients who came to me at cancer of the cervix stage 1. In fact, I've seen only one who came stage 1, because stage 1 treatment 100% cure rate. Stage 4 treatment cure rate almost 25% of cure rate of cancer stage 4, cancer of the cervix. So you find that what we need to do is to know the diagnosis as early as possible. I know, especially for our viewers who are looking at us from peripheral regions, mainly away from big cities, you find that to get a diagnosis for cancer, it takes almost 1 month, 2 months, 3 months. You have got a swelling, biopsy has already been done. It has been taken, because most of the biopsies, of course, and diagnoses are made by pathologists, and most of them are found in Nairobi. And that's you find that for a biopsy, to get all the way from Garissa to Nairobi and back to that patient, it will take a bit of time. And that's why we lose a lot of time. Now, there's another factor which is very important. You have the diagnosis, start of the treatment. There are so many patients who know they have cancer, but they have not started treatment. And that's time, actually, this lag period, which actually we normally lose a lot of patients between diagnosis and treatment. And that's why we find that actually most of the patients, by the time they come to treatment, there's a lot of dilly-dallying. Of course, it's many factors. The major one is finance.
All right.
Yes.
And you'll tell us, Dr. what could be done to support patients, especially those in areas where they do not have access to diagnosis and even treatment. Lucy Njeri now joins us. Lucy Njeri is a breast cancer survivor. Good morning to you, Lucy. It's great to have you on the show as we talk about cancer management and treatment. Please just briefly take us through the diagnosis, the cancer diagnosis. Did you have any symptoms, or was it a regular checkup on your part? Right, Lucy Njeri is here with us, and of course we will be speaking and engaging her